Hi there, welcome to my Intradermal OSCE. My name is Chris Ewart and I'm going to be doing an injection on my patient Caitlin today. So, lignocaine here is a great numbing agent, used especially for when you're giving IVs or as a ring blocker. So today we're going to be using it prior to giving Caitlin an IV in her hand. So, Caitlin, is it alright if I give you an injection today?
Yep.
Awesome. And do you have any allergies to anesthetics?
No.
Perfect. So, got all my PPE on, so I've got my gloves and my glasses and all my equipment in front of me. So, starting with my sharps box, very important, your alcohol swab, got my blunt tip drawn up needle, 3mm syringe, lignocaine, which I'll drug check very shortly, and my 27 gauge needle. So, giving intradermal, want to use smaller than a 25 gauge, which we've got here. So, Lily, can you please drug check this for me? So I've quietly read it to myself, and now she's going to read it out loud back to me.
That's lignocaine, 1% injection, 50 milligrams and 5 ml. Expires April 2020.
Perfect. So, lignocaine 1%, 50 milligrams and 5 ml, and expires in April 2020. So that's all done. So now getting my alcohol swab out first and swabbing the area. So because I'm going to be giving the IV in her hand, so I'm going to put the lignocaine, so starting in a circular motion inwards, working my way out. Awesome. And while that dries, I can start to get my other gear ready. So for an adult, we use between 0.5 and 1.5 mils of lignocaine, and you normally just put it in until you see a bleed form. So that's what I'm going to be doing today. And for a child, you'd use between 0.2 and 1 mil. So draw out the lignocaine. So I'm going to draw up about 1.8 mils, and that just allows me to get rid of the excess air that is in the syringe. And getting rid of the air. Now I have 1.5 mils remaining. So I'm not actually going to put this down, because if I put it down I have to label it. So I'm going to hold on to it, unscrewing the drawing out needle, straight into the sharps container, getting my 27 gauge needle, putting that on the top, still sealed, so nice and clean. Now when we're giving the injection, I'm going to put it in at a 15 degree angle, sorry, not 30. So currently you're going to feel a sharp scratch as the needle goes in. Sharp scratch. Aspirating, make sure I'm not in the vein. Perfect. And then put in fluid in. So in this dummy you won't see a bleed form, but I would expect to see one form if this was a real human. Alright. So in a human, a bleed's starting to form now. We can take the needle out and straight into the sharps container. So, time that we've put it in is 12 p.m. So, 12 p.m. we used a 27 gauge needle, and we put 1.2 mils of lignocaine. For the next minute or so, we're just going to watch while the anaesthetic does its work. We're just going to watch, make sure there's no signs of allergic reaction. So I can see my bleb has formed, which is really good. So for the next minute, like I said, we're just going to watch for signs of anaphylaxis, so warmth, if there's any itching or redness forming, and then we can go ahead with our cannula.